Hey everybody, it's Dr. Tim Harrigan with Synergy Wellness. Okay, I wanted to get on here and explain one of our tests that we do in our practice on pretty much every human being that comes through the door. It's a body composition analysis, but it's actually much more than that, and it's considered the gold standard. So this is a device that they use for government research, animal studies, university studies, stuff like that. So we've used this forever. It's a phenomenal device. Every human needs to use this at least a couple times a year to track what's going on with their cells, their body composition, fat, muscle, bone, and so much more, you guys. So let's get into this. So obesity, one of the biggest problems we've ever dealt with. There's never been more adults that are overweight than in this time right now. And our lifespan is actually getting worse, you guys. Our lifespan for the first time in history is getting worse. We are no longer increasing our lifespan, which has been happening for a little while. But our kids now, they say, are the first generation of children that will not outlive their parents. This is a reality now. We've been kind of, foreseeing this for a few years now. But in fortune.com, they actually predicted, they actually showed the charts that are showing it's a reality now. So most of us are eating too much garbage. This is not really food. This is a hamburger we've had for over, it was 2008, so 12 years, almost 13 years. And it doesn't even grow fungus and things like that. It's like so processed, it's not even considered food anymore. Mother Nature doesn't even want to, gulp it up and digest it and decompose. So guys, this test is phenomenal. You're going to notice though that if you've ever had other body composition tests with like skin calipers or other measurements, you've been told your body fat percentage. Percentages are not a good thing to monitor. It's very misleading. All it does is compare fat to your muscle and bone. So maybe you have not enough muscle and bone in the body, so it makes the fat look a lot bigger percentage-wise, right? So it's very misleading. Your weight is misleading also. Weight is misleading because if I weigh 200 pounds today, I don't weigh 200 pounds, but, and I weigh 200 pounds in a year from now, I don't know that maybe I lost 15 pounds of muscle and gained 15 pounds of fat, right? A weight scale, a BMI, I'll get into that here shortly, and a body fat percentage are almost worthless in helping you keep track of your progress. So let me share my screen. I want to just go over an obesity chart here. It's a trend, and this is an old one. Keep that in mind. So you can see this chart here. 1988, this chart basically shows all the red states had more than 35% overweight or more, okay? And again, guys, it's worse and worse and worse every 5 years. So this is 1988. You can see, I don't know, it looks like maybe a dozen if you count some of these little tiny ones over here. Of states that had 35% or more overweight adults. So I just want you to keep in mind, look how many years we have here. Just 12 years later, we are dealing with every state more than 35% obesity. That was 20 years ago. I've used this chart for a while, but I think it really just gets the point across much better than our recent trends that are getting worse as well. So crazy, right? Let's go into the actual test itself. And this test is always going to be higher. If you do happen to look at the percentage, which I'm going to talk you out of, this test is always going to be higher than what you've been told. So maybe you've been told you're 15% body fat or 32% body fat. The problem with that is, especially with a skin caliper test, it's measuring just the skin fat, right? The fat that's just below the skin. Well, we also want to know what is around the organs and bones and everything in the body. So our device, it's always going to be higher than what you've been told. So don't freak out. The tests you've had done in the past, though, just were not very comprehensive. This checks all the fat in your body, okay? I have quite a few things to go over here, but there's a couple links that you can go to get more information. Of course, this video, but also Dr. Mercola has an article on this too about phase angle and cellular health. So some of you have heard of Dr. Mercola, so you can get that link hopefully below this video. This is the legend, so to speak, that we send with you when you get this test, because it's a scientific format, basically. If you look at what we're going to look at here shortly, this test there's a lot of data here. It's really cool, but it can be kind of confusing at first. So over time, you'll get to know how this works, what it's measuring. It's called a bioimpedance analysis. It tells me about the fats, your BCM, which is more the metabolically active tissue, muscles, organs, things like that. We all know what fat is, right? Fat is just fat. But it also tells us extracellular mass. This is the structural material. So some of you are worried about bone loss. but it tells us about bones, ligaments, cartilage, anything that's structural in the body. There's 3 different measurements that tell us about your cellular health. Phase angles, general cellular health. Capacitance here is a charge. It's like the charge of your cells. So our cells are like batteries. When I pass away, for example, my phase angle goes to 0, my charge goes to 0, so phase angle and capacitance would go down. Literally, your cells are like little batteries, okay? Impedance, it tells us about that as well. Impedance is how well your cells are basically communicating with one another, kind of how your body's functioning all together, which it needs to function all together to be healthy. So again, that would go to 0 when I pass away. It tells me about your metabolism, your intracellular water versus extracellular water. So this is the handout we give you when we go over this, when we do this test on you, okay? So the cool thing about this test also is, I want to skip ahead slightly, it keeps track of all your old measurements. So it's pretty cool. Our patients love this because I could maybe set some goals for the next 30 days or 60 days, retest myself, see exactly how my CrossFit program or my Pilates or my diet or my going vegan or going paleo, whatever, how those programs work for your body specifically, because we all respond differently. So if we're going to monitor that stuff, you want to use this device, okay? It's the most accurate way to do that. So let's come on up here. This is just the front page. You can see it's over 10 pages usually, the report. This is a percentage. So I want to talk about that again. I don't care about your percentages. These are very misleading. For example, when you look at this chart on the right, fat should be 17% for this individual's age, height, you know, whoever it is that we tested. This was somebody that we did recently that came in. So ideally they should be 17%, but they showed up as 25%. But do not worry about this. Skip this chart. It's worthless information because it's a percentage. Maybe this person has 25% bigger fat pie chart here because, again, their muscle and bone are smaller than they should be. So it's really misleading, just like your weight is misleading as well. So let's go to the second page. This top chart is also in percentages if you look on the left side here. We don't care about percentages. They are misleading. If you go down to this chart here, this is what we want to spend a little bit of time on. This is the weight of these 3 different body compositions in your body. Fat is fat. Again, BCM is your muscle, organs, the metabolically active tissue, the good tissues in your body that are doing work, right? ECM is more the structural stuff, bones, ligaments, cartilage. Again, these last 2, BCM and ECM, these are good tissues. We don't want to see a weight loss program where you actually lose these 2 tissues. That is not good. I don't care if you're 30 pounds lighter. If 20 pounds of that was muscle and bone, that's a horrible weight loss program. So we have talked a lot of people out of these mainstream weight loss programs you guys have all heard of, you know, HCG, you know, I'm not going to name some of the big names, but you guys have heard of them. We talk a lot of people out of those because, yeah, they can help some people lose weight. They're all unhealthy. They usually use packaged, processed, garbage, calorie counting foods. And most of the time you're losing muscle and bone. So you've heard of yo-yo diets. It's a big problem with those diets because you're just reducing calories, which allows you to lose muscle and bone and just maybe a little bit of body fat. Sometimes people don't lose any body fat when they lose weight, and that's not good, of course. So let's go over this chart. So green is this person's normal value. So based on their age and some other criteria that go into the software, they should have about, you can see here, 32 pounds of fat just to be healthy. That would be the ideal amount of body fat in their body. So the green is normal. That's where they should be. Blue is how we actually measured that person. So you can see there may be, I don't know, let's say not quite 100%, but maybe 60% more fat than they should have here. You can see this discrepancy. So this is a male. We would, you know, like him ideally to maybe lose, let's see here, that's about 10, maybe 15 pounds of this to be perfect, okay? So again, normal is green, blue is how we measured you, okay? So these are the good tissues. So keep in mind, let me go over fat a little bit more actually. Most people that we measure are healthier than the average population out running around, okay? Because our patients are typically proactive with their health. They're being, you know, they're making changes in their environment, lifestyle to improve their health, as opposed to the average person that just eats processed food all the time. They don't exercise. So keep in mind, when I talk about averages, I'm talking about what we see in our office, which is a little bit healthier portion of the population. So even of that category of people, If you look at this green normal person, most of the time I see people either at double the amount, so if you just take this and put another one on top here, or triple the amount of fat they should have. So this person isn't quite double, but they do have more from optimal than they should as far as body fat. So keep in mind, most people have double to triple the amount of this fat on average in our office. So these two are the good tissues. So normal would be this, and normal would be this for bone. So this is muscle, this is bone. This person measured basically, let's say about 8 pounds less muscle than they should have here, right? As you can see, it's about not quite a full bar below there. But this is pretty good actually, because the average person, if you go to this green bar, the average person actually usually has like a third to half the amount of muscle they should have. So even though this person isn't optimal for them yet, they're better than the average person, which is about a third to halfway down here. So you can see they're a little bit better than that. Bone, pretty much perfect. So this is an ideal bone, ligament, and cartilage measurement because they are at exactly where they should be compared to normal values. Keep in mind, most women specifically, it's men too, but mostly women have a third to half the amount of this than they should. That is not good, as you know, right? Their bone density is probably very poor because the amount of bone in their body is very poor. So this is kind of the bad tissue, right? The fat is what we think of as the bad tissue, and these are the good tissues. So again, if somebody loses 30 pounds, usually on most programs, I notice they lose 10 pounds of bone, that's not good, 10 pounds of muscle, that's not good, and 10 pounds of fat. But in their mind, they lost 30 pounds typically of the fat. That's what they think they lost, right? So this instrument we use is phenomenal. It's helped so many people lose weight and kind of keep track and learn about their body. The trends are one of the coolest things with this though. So if you look at, let me see here. So this is a trend chart of the bone, which is green, muscle, which is red, and fat, which is the yellow. So actually this person from last time we measured them gained a little bit of fat. If you look at these bars between the spaces here, that's about 3.5 pounds. So this person, let's say, gained about 3 pounds of fat, and they lost probably about 6 to 7 pounds of muscle and about 5 to 6 pounds of bone structure, okay? So this is a perfect example that this person lost weight quite a bit, right? 10, 12, 15 pounds, but they gained fat. So in their mind, that scale was lighter, they have less fat, they actually have more fat. That is not good, right? So whatever this person was doing, we want to fine tune it. What I would guess, because this is like a crystal ball into helping people, fat is 90% affected by diet. Okay, so I'm guessing diet was off a little bit, okay, to gain 3.5 pounds of in 2 months, basically. I'm guessing exercise, as far as resistance, probably specifically, resistance exercise was lacking during that calorie reduction maybe that person was doing. And so they did lose some bone and muscle. So this is a person I would want to talk to and say, hey, we're not really on track even though you're losing weight. You're actually getting sicker as we go through here because you've lost good tissues and you actually gain more of the bad tissue, which is really deceiving. So very, very helpful to kind of track what's going on, what your lifestyle is doing, and how it affects you and your body. So BMI, I'm going to keep this real brief on this. BMI is a worthless, completely worthless measurement. This is what most medical offices use as their gold standard for tracking if you're obese or not. Just let me give you one example and you'll understand why this is garbage basically to look at. So if I have two males that are, let's say, 230 pounds, okay, and they're both 6 foot tall. Okay, we get that picture in our head. Well, one of them, he's 5% body fat. He's a bodybuilder, right? He's 6 foot and 230 pounds, right? So then I have the gentleman next to him, let's say his brother, and he's also 220 pounds and 6 foot tall, but he's 30% body fat, right? Do you know that they would have the exact same BMI, even though he's 5% fat and he's 30% fat, and they look very different, of course, right? So that is an example as to why BMI is worthless, because it does not take into account the composition of the body. It only takes into account your height versus weight. Literally worthless. I would never, ever tell somebody what their BMI is. So this is part of the report here, but understand it is garbage. We just want to cancel it out there, okay? So don't look at that. You can look at it, but just understand that it's not telling us a whole lot. So phase angle, again, capacitance tells us what's going on there, and impedance. These are the cellular health markers. phase angles, general cellular health. So I want you to keep in mind, you can read over that other chart that helps explain more about these. What I want to explain here though is the green and red are the normal kind of section here. So when this person started, they were right here below the red area. So this red and green is kind of like the normal range, okay? Here's the deal though. I've done this on over 10,000 people. We've only had about 200 exactly actually at this red dot or higher with their blue bar. So blue is their actual measurement. Red and green is kind of the normal range that we're comparing them to. So you can see this person was below normal, but they're actually better than a lot of people. Most people are way below this normal. So if you get this test done and you're like, holy cow, I'm way below the red, I feel like I'm dying here, because you can see some of the things with phase angle that can contribute. Basically poor health, but malnutrition, HIV, AIDS, cancer, abusive lifestyle, chronic alcoholism, old age. So as your phase angle goes down over time, you're losing your health. So this is a general cellular health marker. This is very important to understand cellular health. Your cells are the building blocks for the tissues and the organs. So it all starts on the health of these cells. Very, very important to understand that. Keep in mind though, I've only had 200 people that had this blue dot at the red or higher on all 3 of these tests. So let's see where this person was on here. So they were slightly below, which is actually slightly better than most people on average, but it went down. So again, that's another confirmation they're probably not being as active as they were with that first measurement. And again, they're way below this measurement. And then you have impedance, and this one happens to be above the red. So there's no green on impedance, by the way. It's just at red or above, okay? So this is cool. Their cells are actually improving better than they were last time. I'm guessing there's a supplement this person is taking, or they're drinking more water, something like that. And to see that improvement while the others decrease, there's something still positive that they're doing. I don't know exactly what that is, but it kind of gives us some clues. So impedance increased, so the cellular communication increased, their charge of their cells or capacitance decreased, and their phase angle decreased as well. And that's a general cellular health marker. So learn more about those, you guys. This is an exciting test to be able to track to see if you're actually improving your cellular health over time. And it's crazy, right? So if your phase angle just keeps going down and down and down, and 5 years later, it's even lower, 10 years, you're slowly getting sicker, even though you don't feel it overnight, right? So we can track very sensitive things with your health. And most people have never even had this test done. And it's one of the more important things that we track for somebody. This person's metabolism is kind of at the bottom now. Between the green and red is normal range. So they actually started out pretty decent, but because of whatever they were doing for the past 2 months, their metabolism is actually much worse. So again, I'm guessing they weren't moving around a whole lot, you know, being active, that sort of thing. So hydration of your cells. This is very important. This is the second most important thing in your body after oxygen. Okay, so you can see this chart here is percentages. We don't like percentages. They're misleading. Let's go down here. Again, here's percentage in a bar graph. And then we have fluid in liters. That's what I'm gonna look at with you. So this person has total body water of about 46 pounds of water in their body. They should, I'm sorry, that's where they should be. They only have about 44 pounds of water though. So they're lacking a little bit of water when we look at overall water. Now, part of the problem here isn't the amount of water in this person's body. That's what we all think, right? Drink more water, drink more water. Well, maybe you need to do that. More important than water is usually electrolytes. And do not go out and buy Gatorade or Pedialyte or any of those chemicalized garbage products for this. We have very specific things we use for this. But let me show you why this person needs electrolytes. I don't care how much water you have in the body necessarily. What I do care about is the majority of that water actually in the cells? Do you have like really full water balloons as opposed to empty water balloons, right? If you have empty water balloons, that means there's more water out of the cells, which is extracellular water or water retention, or you're retaining water, right? You know, somebody with swollen ankles, a pregnant lady, something like that. So here's a problem here. When we look at liters of intracellular water from normal, they are lacking water on the inside of the cells. So they are dehydrated actually, even though they're total body water, it seems like they have a lot of water in it. And so that means that I have more extracellular water than I should here. So that blue is above the green. We don't want extracellular water. Your body has to work harder. You're gonna have less oxygen. Your heart has to work a little harder to pump through some of that swelling and stuff. So that's not good. So we can keep track of this as well. This person, they lost actually some water since last time we measured them, I believe, because they lost muscle and bone, right? You saw that earlier. And their intracellular water went down more than the extracellular water. So they're actually more dehydrated than they were before. So we want to talk to this person now about electrolytes, okay? So you can see, guys, this is just a phenomenal chart. There's explanations below every area. It's kind of a lot of information, of course, but I'd rather be more thorough than less thorough. And if somebody wants to learn more about it, you know, the information's there. So we provide this report along with you. We give you the report when you come in and get the test, but we also give you that legend, the guide that helps you really study this stuff and understand it over time. So guys, reach out to us if you want to get tested, or hopefully this was just helpful if you have been tested already, and reach out if you guys have any questions or you want to schedule this sometime or just chit chat. Have an awesome day, guys. Bye-bye.